This is our second of our 2 September monthly calls. So we'll go ahead and dive right in. Our agenda for today is to review some important upcoming events, including our regional meetings for fall 2025, the Specialist Clinical Champions meetings, as well as the Learning Community event that we'll be hosting this month. And then talking a little bit about the new date for the 2026 collaborative-wide meeting. We'll talk a little bit about a new partnership that hopefully you've heard about through email with Advanced Health Technology Services that we're hoping to help leverage to expand the utilization of the PPQC QMI data use case and the data that you're submitting as a part of MCTTD participation. We'll talk about the UACR performance measure and a couple of resources that we've created to help with that. We'll review that the smartphone app is live. Then we'll talk a little bit about the performance year and the dates for our upcoming performance reports associated with all 3 measures, as well as the dashboard visualizations that will go into the patient data dashboards in November. All right. So as hopefully all of you know, our upcoming regional meetings are on Wednesday, October 22nd, and that is for the Blue Jay, Black Bear, and Riverwalk regions. On Thursday, November 13th is the Badger, Bluegill, Gray Wolf, and Sand Dune regions. Those meetings are broken up into your regions. However, if you do not or are not able to attend the meeting that your region is slotted for, please do reach out to us and let us know that you have a conflict. You are able to attend the other meeting if that one works out better for you. As a reminder, the fall regional meetings are PCP only. Your specialists do not need to attend like they do in the spring. We do have individual Specialist Clinical Champions meetings that replaces their attendance at the fall regional meetings. For the regional meeting agenda, this is as it stands currently, subject to change. As per usual, we'll start with a welcome and clinical updates by our program directors. Anything that's late breaking as it pertains to type 2 diabetes care will be shared in this section. We'll go through some practice presentations. We had a number of practices that were exceptionally well performing on the baseline rates for the UACR screen measures. And so we'll be having presentations from a few of them talking about some of their best practices, lessons learned, and things that you may be able to translate into practice at your own practices and physician organizations. And then to wrap out the meeting, we'll be going through some reminders about MCTTD requirements and upcoming learning community opportunities. All right, so for those specialists for fall, our Specialist Clinical Champions meeting for nephrologists is Tuesday, October 7th, and then for endocrinologists is Thursday, November 6th. Those are the same time frame, so 6 p.m. to 8 p.m., same length, same time of day as the specialist meetings, but they are their own standalone meetings. And then our September Learning Community event is good to be on low carbohydrate diets. We try to do this one once a year or so. It's one of our most requested topics, and so Rina Hisamasu, our registered dietitian on MCTTD, will be leading this as she does usually at least once a year, and that is currently slated for noon on September 26th. All right, so with regards to our 2026 collaborative-wide meeting, we are going to be at the same venue as we were last year. We do know that there were some issues with the audio. We are working with the venue to try to work out some of those issues, and then if those issues, if they continue to be issues this next time around, we'll look for other venue options. But we think that we have a pretty solid plan in place to help improve the audio quality, so hopefully that takes care of that issue. The big change here is that instead of being in June as we have for the last 4 years, our collaborative meeting this year will be on September 10th. And so the idea behind this is twofold. One, to help spread it out a little bit from the quick turnaround right after the spring regional meetings for some of those later regions that wrap up in mid-May. And then 2, also so that we get out of the summer months when folks are at higher risk of being on family vacations. And the September 10th date was chosen because it is after Labor Day. So hopefully there are less risks of folks being gone and away after the kids are back in school. All right. So as you all know, our UACR performance measure pertains to both nephrologists and primary care physicians. However, we had a couple of requests come in for both patient-facing and provider-facing or clinician-facing informational handouts pertaining to why UACR testing is important for patients with type 2 diabetes. And so this is the patient-facing one. We did run this through extensive reiterations with our patient advisory board. So we do have real patient feedback on this. This is live on the MCTTD resource library for you to download. And the available here is a link that you'll be able to click when the slides from today's meeting are sent out. All right, so for the provider facing, this is very, very recent. This went out just on Monday, and this is also available on the MCTTD resource library. And then with this one, we are hoping to get some initial feedback from clinicians, most specifically primary care physicians, on the content of this one pager. We want to make sure that this one pager is helpful. Because it's one page, we have limited space to include information. So we want to make sure that the information that we have included is the most pertinent, the most helpful. We want to make sure that it's at the right level. We don't want it to be, we want to kind of meet folks where we are, which is tough when we have quite so many physicians, but this is typically aimed towards the primary care physician, nurse practitioner, physician assistant, nurse, or other clinician in a primary care office. So that feedback survey is also live. It is it does meet physician level learning community requirement, but note that in order for a physician to get that credit, it has to be a physician that fills out that feedback survey. We would still absolutely love to hear from advanced practice providers through that feedback survey if they wouldn't mind taking the time to fill that out and provide us feedback on the content. But for physicians that fill that out, that will cover their physician level learning community requirement. All right. So as a reminder, the MCTTD app is live. It is available both on the Android App Store or Google Play and the iPhone App Store. This app is a first version. We're going to be continually working on adding additional features and functions. As it stands right now, it contains a mobile resource library. So all of the available tools and the ability to share them via text or email directly to patients is a feature through this app. We also have a light version of the coverage checker. So it's more mobile friendly than it is on the website if you access it through a smartphone, and will have the same ability to look up coverage for medications and CGMs. And then our news and events are also available here. So you're able to quickly reference when that next learning community event is without having to remember the slides from the last PO monthly call. All right, so our partnership that we're really excited about is with Advanced Health Technology Solutions. So many of you have worked with this group before. This is Ed Worthington's group. They contract directly with Blue Cross for things like the vendor initiative to help facilitate data exchange between the physician organizations and payers. They have extensive expertise within QMI APS data, otherwise known as PPQC data. There's three acronyms that kind of refer to the same thing. And they're going to be helping out because MCTTD identified a gap in our ability to support you as the physician organization in meeting certain aspects of the participation agreement with regards to submitting data that we need for quality improvement purposes. And so this partnership didn't necessarily come around because you as the PO were doing anything. It was really wrong. It came about because we didn't have the ability to support you in making changes or improving things or really investigating things outside of the University of Michigan health system. And so because of that, AHTS has been brought on as a strategic partner and will be helping with that. They've reached out to many POs already to get an initial meeting in the book. And like I said, this is not because any PO has done anything poorly or incorrectly. This is really just to understand current practices such as what every PO's ACRES methodologies are, and also to help identify any issues with regards to things like patient matching or submitting units fields that are new and things like that. So more to come, but that's this partnership. And like say, those initial charges are really just more of a fact-finding mission and to help improve things, not because anything specific is broken. Of note, and this is important, HTS won't reach out to any of your practices without prior communication. They're going to send all of your communication through POs. And then we'll reach out to individual practices alongside you as the PO. Question from John. John, is a meeting with HTS required? So this is required is a strong word, but it is a part of the MCTTD participation agreement to facilitate the exchange of PPQC APS clinical data as a component of MCT2D. So we would ask that you meet with AHTS, like say it's not that there's anything specifically wrong, but meeting with AHTS would fall under the participation agreement of facilitating effective data exchange with MCT2D. If you do have specific concerns, please feel free to reach out to us directly, and we're happy to hop on a call and discuss. All right. For the primary care VBR year, that began, as you know, on September 1st. The updates on the portal for the PO scorecard are live, as well as the PCP scorecard and the task tiles on your homepage. Under the people view, you should be able to now see physicians who have been approved for VBR for the current year, as well as the VBR rate for the current year based on last year's performance. And then if any physicians were not approved for that VBR, the reason that they were not approved for that VBR, that is all live. And then physicians that were approved for VBR have been made available or visible on the portal back on September 2nd, based on that list that the PO admin leads and primary contacts attested to back in July. All right, so a couple other quick reminders on when things are going to be coming. Pertaining to the progress reports for the VBR performance measures, the HbA1c year 2 measure, we have slated for progress reports to be available on the admin portal in November 2025, February 2026, and then the final report in July 2026. As a reminder, we're still waiting on those HEDIS value or HEDIS rates to be released. That'll be in November. As a reminder, everybody is performing exceptionally well on this. Nobody should be concerned. And we don't anticipate that those HEDIS rates will substantially change from what they were for this last year's performance measure. But if in the off chance they do, we'll adjust to a tiered approach as we've discussed in the past. As it pertains to the PCP and nephrologist UACR measure, the October progress report or the first performance report will be coming out in October, followed by March 2026 and August 2026, and then a final standing of your performance will be available in February of 2027. And then those exact same dates will be the same for endocrinologist on the 95251 CGM interpretation measure, which is only applicable to endocrinologists. So following that same report cadence as the UACR measure. Additionally, visualizations will be available in the MCT2D patient data dashboard summary measures page. So the dashboard 2.0 link for those with access, if you go to the overview or the summary measures page, the current visualization for the A1C that is right along the top in orange, that will be updated to both the UAC or the A1C year 2 measure and the UACR in 95251 billing measures as well in mid-November. So those will be coming then as well. All right. So ramping up with our next kind of strategic initiative here. Another question in the chat. Should I wait until October and November for the progress report, baseline report? So yes, so UACR and is coming in for the first time in October and then November for A1C. So those reports will be coming live for at the practice level at that time. Yeah, so those reports themselves will be at the practice level. All right. For our next strategic initiative, we are ramping up our work on prediabetes. So we have been doing a number of design sprints and focus groups to help guide the work that we're starting to do within the prediabetes space. And so we have at this point launched our first tool. It's live on the available on MCT2D right now, but this is the prediabetes screening guide. So the intent of this tool is to help with straightening out the definition, the clinical definition of prediabetes, how, when, and who to screen for prediabetes, and then some guidance on billing and coding for prediabetes screening. That is available, and that link is there on the slides for you to click on. This is the screenshot of the first page of that tool. All right. We are also developing a one-stop shop platform that will feature both patient and provider educational resources and tools such as a map of all diabetes prevention programs across the state of Michigan, as well as provider algorithms and treatment strategies. This will be a separate website that'll function very similarly to the Jumpstart website, if anybody's familiar. It'll be outside of the MCTTD website, but tied in and linked throughout so that it'll be able to be easily accessible while still keeping all of the prediabetes resources and tools together in one place. Thanks, Renia. We're excited about this as well. All right, a couple other examples of the resources that are going to be available on that page. You can see in the bottom right-hand corner a picture of the DPP map that was referenced on the last page. This is what it'll look like roughly. And then up top, we have some diabetes prevention strategies that will be available through a website format that won't necessarily have to be downloaded into a PDF like the vast majority of our tools are currently. So this will be available more as a didactic website rather than a static PDF, which will be a little bit more user-friendly and available to use on a mobile platform in a simpler manner. All right, and then the last one here is a kind of a homepage screenshot of that one-stop shop platform. So you'll be able to navigate across a number of different toolbar menus that have different resources and guides that are available on this platform. All right. So with that, a little bit of a short meeting today for MCTTD's side, but our next month PO calls are currently scheduled for Wednesday, October 8th and Monday, October 13th. We do have these currently scheduled. We know that we have the regional meetings coming up, but we'll keep these on the calendar in case we have updates to give you guys. And if there is nothing besides what we're going to be talking about at the regional meetings, we'll send out cancellations. But at this time, please do plan for those as they are currently scheduled. With that, I will turn it over to Inhale.
Thanks, Jake.
Oh, there's a question in the chat. Can you elaborate on the demographic survey? Yes. So the practice demographic survey, and this just launched, and so I haven't announced a lot of details in this about that. So just to answer your question real quickly, Mary, the practice demographic survey is something that we're hoping to do on a semi-regular basis, like once yearly or so, where practices will be able to give us some information about their practice structure that will help us tailor interventions and guidance that we work with practices on. That's not being shared anywhere broadly. We're looking to have some information on practices such as the availability of pharmacists that are embedded, or dietitians or care managers, as well as certain different aspects such as rurality and that kind of stuff. So that is a part of your requirement for this current year performance measure. So it would be due by the end of the 2025-2026 performance measure. But you can complete that as soon as you're available to complete that, or as soon as you're able to, Mary, with obviously input from the individual practices, because it is a survey at the practice level, not the PO level. All right, I think that's all the questions. Over to you, Rachel.